Hello and welcome back to the channel. Today we're going to talk about Medicare plans in Hawaii. Congratulations if you've recently turned 65 and now you have new options to explore. So we're excited and let's begin. The first item to consider is now that you're Medicare eligible, you have options to consider for a whole new coverage. So if you've been on an HMSA plan or a Kaiser plan for all these years, now that you're Medicare eligible and the federal government is offering you a Medicare plan, you have an opportunity here to choose a new package and decide whether you're going to stay on something similar that you've been on or move into a Medicare plan. So let's talk through some of these choices. Now, if you are on a company plan and they offer you health insurance after age 65 when you're Medicare eligible, and this is something you need to check with your company or your HR department to find out, see if once you've turned 65, if you're required to enroll in Medicare or the company will still offer you coverage. You also need to check if you're going to stay on that company plan if you need to elect Medicare Part B in conjunction with the employer plan. This is not usually the option if it's a large company, but if it's a smaller business up to 20 employees, it's typically mandatory. Now, if you're on Kaiser and you know you definitely want to stay with Kaiser, then what you do is you just call the Kaiser customer service number and tell them that you're 65 and you're Medicare eligible and you want to switch to Kaiser Medicare. Kaiser does not work with independent agencies like ours, so the path to take if you definitely know you're going to stick with Kaiser is just to call Kaiser directly and make the switch. However, you can use this opportunity if you've been on Kaiser for a long time and considering a switch to see other doctors or medical systems. This is an opportunity where you can make a change. The insurance is guaranteed to be issued regardless of your medical history or condition. So you could shop this around right now and maybe try access to the Queen's medical system or Straub or one of the other numerous medical providers on the island, utilizing, say, UnitedHealthcare, WellCare, or Humana. So now let's talk about the two main options that you'll have when making your decision with Medicare. The first type of Medicare coverage to choose from is called Original Medicare A and B, plus a supplement. The second type is called a Medicare Advantage plan, which has been growing in popularity lately, and that's the private insurance carrier model where they take over your Medicare insurance in its entirety. With Original Medicare plus the supplement model, you elect Medicare Parts A and B, and remember there's a premium for Medicare Part B, which is your physician services. For 2025, that comes out to $185 for the standard base rate, unless you're really high income. So you elect Medicare Parts A and B, that's your hospital and your doctor's office coverage, and then Part D as a separate drug plan. It effectively works sort of like an 80-20 PPO plan with deductibles for hospital and for physician services. The supplement then is designed to cover those gaps. Your Part A deductible, which is $1,672 this year, the supplement covers that for you. You don't have to pay it. And then the 20% coinsurance that you're required to pay for doctor's office visits and physician services. The supplements pick up that 20%, so you don't have to cover that out of pocket. So on most of the supplements, they're covering most of the gaps in Medicare for you. You simply pay your premium, which is going to average in Hawaii about $150 a month for the premium. For insurance carriers, UnitedHealthcare leads in Medicare supplement sales in Hawaii. Humana offers one as well, and they've come on strong. HMSA and Kaiser do not have supplements as they're strictly Medicare Advantage plan carriers. So why would you choose one of these plans considering you have the three sets of premiums actually for Medicare Part B, the supplement, and the Part D drug plan? Well, once you've paid those premiums, almost all your bills are covered, so you're out very little out of pocket. It's really just a matter of paying the monthly premiums. Medicare Advantage plans are really flexible as far as getting access to medical providers. So its strength is you can go see any doctor or hospital that accepts Medicare. It doesn't have an insurance carrier provider network that you're confined to choosing from. So you could go across the country to the mainland or anywhere in Hawaii. All you need to ask is if they're accepting Medicare, and you can use that provider, the plans will pay. Just remember, for Medicare Supplement path then, it's a little more expensive monthly, but most of your bills will be covered. You'll have very little out of pocket, and it's super flexible on gaining access to doctors. You don't have to use a primary care doctor and get referrals to specialists inside of a medical group the way that you do on, say, an HMO plan or a Medicare Advantage plan, HMO. So more flexible, costs a little more monthly, but very little out of pocket when you have actual medical expenses. The Medicare Advantage plan model in Hawaii is popular. Under Medicare Advantage, the insurance carrier actually takes over Medicare Parts A and B and D, and they call it Part C, and so that's Medicare Advantage as the model. With Medicare Advantage, the insurance carrier will control all of your medical treatments and manage you under a managed care model similar to an HMO plan. So for example, Kaiser, if you're on a HMSA, HMO plan, the coverage will be very similar to what you're used to. For Medicare Advantage plans, you'll see the advantage of really low premiums. Oftentimes they are zero, and then you'll see some stronger benefit plans where the premiums creep up to $25, $50, say $75 a month, sometimes even over $100 monthly. You still have to pay that Medicare Part B premium to the government, so you'll still be responsible for the base level $185 premium minimum unless you're on Quest or Medicaid, or unless you're high income, where in that structure the premiums actually increase on a sliding scale depending on your income. As far as how does a Medicare Advantage plan function, or how does it work, really works sort of like a traditional plan that you've been on your whole life. So it's been, say, an HMSA, HMO plan, or a Kaiser plan where you have office visit copays, maybe a little deductible, and then you pay a co-insurance percentage or copays up to an annual max out-of-pocket number. That's how a Medicare Advantage plan works. The average max out-of-pocket, or your total risk number on a Medicare Advantage plan in Hawaii, is $6,700. So you can expect that to sort of be the worst case scenario if you enroll in Medicare Advantage and you have a really bad year medical expense-wise. So the benefit then, say, to a Medicare Advantage plan is that monthly premiums are cheap or are often free. So you'll save money monthly, but as you can see, $6,700 in total risk max out of pocket on average is kind of a higher number. So if you have a bad year and you visit the hospital, you could get hit with a pretty good sized bill. You also lose some control of your treatment, as on Medicare Advantage plans, about 60 to 70% of the claims are subject to review for approval at the insurance carrier. So aside from, say, just regular doctor's office visits, simple prescriptions, if you have lab or x-ray or surgery, it's going to go through a claims review process before you're able to proceed. Lastly, let's talk about Quest members, or people eligible for federal Medicaid. There are specific plans which cater to you for that, so they provide extra benefits on top of the coverage if you are enrolled in Quest or Medicaid eligible. So you can get plans without copays or co-insurance, so you're not paying anything out of pocket. You can get over-the-counter allowances of $100 to $150 on your plan, depending on which option you choose. Things like dental, vision, and hearing can be added to coverage as well, but you have to select a particular plan. They're called dual special needs plans, or D-SNPs in the industry, as they say. But if you are eligible for Quest or Medicaid and now Medicare, contact us and we'll be sure to show you the right options for you if you're interested in receiving the strongest benefits possible. So thanks for tuning in with us today. Go ahead and like and subscribe to the channel below. If you have any questions or would like to receive a quote, or just need some assistance enrolling in Medicare, feel free to contact us at the number below or at the website. Thanks so much.